Money for Life is about retiring with confidence. It's working with your advisor to plan for your retirement needs and making sure you have enough money to last the retirement. For as long as you're retired, you know you'll always have basic living expenses to cover, like food, housing, utilities, and so on. And of course, you'll want to spend money on fun things like travel or other new experiences, which you'll likely spend less on over time. But there are other things you need to think about when building your retirement plan, and one of these things is your health. In the early years of retirement, our health expenses are usually quite manageable since we're in good health. But as time goes on, our health changes, and we gradually begin to spend more on our medical, physical, and personal care needs. In fact, we'll typically move through what is commonly called the 5 stages of care. We enter retirement in the Independence Stage. From there, most of us will move on to Interdependence, then Supportive Living, followed by Crisis Management, and lastly, Dependence. The level of health care and personal assistance you'll need, and the cost to meet these needs, will increase with each stage. Let's take a closer look at how and why. In the Independence Stage, you've entered retirement with a pretty good understanding of your current health and what it takes to manage it. Your health needs at this point, like paying for existing medications and therapies, will be part of your basic living expenses. And now that you have more time on your hands, your goal may be to maintain or improve your health, so you can spend more time doing the things you really want to do. Making choices, like hiring a house cleaner, or spending more on wellness activities, like joining the club or gym, will be part of your lifestyle expenses. As time goes on, you'll gradually move to the Interdependence Stage. Here, your family starts pitching in and helping with some of your routine tasks, like shopping, transportation, managing finances, and strenuous household tasks. Eventually, you'll start to need help with basic physical activities, like bathing and getting dressed. New health issues also means more spending on things like medication and medical equipment. Most people rely on their spouse and family to do what they can, and many will hire in-home personal care workers to lend an extra hand, especially if family members don't live nearby, because these become harder to manage on your own. And while government programs might help with some of these costs, not everything is covered. In the crisis stage, care needs become too much or too complicated for family members to handle on their own. It can happen suddenly, so caregivers need to immediately rely on professionals and formal care management to provide the support needed. Keep in mind, a crisis can happen at any point in retirement if you have a serious accident or illness. If that happens, you could find yourself experiencing stage 4 much earlier than expected. In the final stage, diminished physical or mental abilities result in total dependence. 24-hour medical support and care is required, usually in a long-term care facility, since families can no longer give the type and level of care that's needed. The progression through the 5 stages of care will be different for everyone, but whatever the journey, health needs and costs will grow with age. It's a fact of life. It's important to financially plan for your health as it is today and for what it will be in the future. Interested in understanding more about what the 5 stages might mean to you and your plans? Ask your advisor about how to address your emerging health needs with Money for Life. Start the conversation now.